The Neurodevelopmental Follow-up Program is really important to standard cardiac care because the field has really moved. So probably 10, 20 years ago, the emphasis was really on perfecting the surgical techniques. And there's been tremendous advances made in that so that the majority of children with even the most severe cardiac defects survive to adulthood. But now we're realizing that surgery is not the end.
Children's Hospital of Wisconsin was the first program in the country to establish standardized developmental follow-up for our programs as part of routine follow-up care for these children. There are now guidelines that have come out from the American Academy of Pediatrics and the American Heart Association that recommend exactly this kind of structured follow-up.
And so what's really important to families after the child gets through surgery is what's the child going to be like? How are they going to do in school? Will they be able to get a job? Those kinds of things. And so we really feel strongly that we need to be proactive to look at how the kids are doing from a developmental standpoint. And we will be following you as the child ages.
If you can identify those problems early and get early intervention and supportive therapies in place, we might be able to help ensure that kids are reaching their optimal potential.
As a parent of a child with a congenital heart defect, I think your initial concerns are always on the child's survival and getting them through surgeries. But once you get over that milestone, then you start worrying and thinking about how is the child going to do long term. And for my husband and I, that was really important to us, that the hospital just wasn't focused on their survival, that they were also focused on how these kids were going to do long term.
Which one do you use to drink?
So for the younger children, when they come to clinic, there are formal assessment tools that we use, but really they're very much play-based. So they may be doing things like stacking blocks or putting pegs in a pegboard, running down the hall, kicking a ball. So we're assessing those language skills, motor skills, their thinking skills. But to the child, they really don't understand they're being tested, if you will, because really it's fun. As they get into school age, then we start doing some things that seem more like school-based tasks. So they may be doing math facts or writing sentences, spelling, reading comprehension, things like that. So it's really family-focused care beyond just the heart.
We felt reassured that Liam was getting the best possible both medical care as well as checking to make sure he was doing okay neurologically and cognitively. When you have a little guy, it's really nice to have it all taken care of for you.